Here at St. Luke's, we're super excited about being able to deliver behavioral health services. This is something that we're really passionate about and something that our community sorely needs. This is something that for the longest time we haven't been able to deliver in an effective and coordinated way. And with the creation of our service line, this is going to allow us to more effectively deliver care across the continuum of the healthcare delivery spectrum.
So here in Idaho, we're in categories we don't want to be in terms of we're in the top 5 in terms of need for behavioral health services and bottom 5 in terms of providers. So that's a constant challenge for us, is how to get the care that we need for the patients that we have. So what we do to try to accomplish that is, since it's a challenge to recruit providers here, rather than continue to try to focus on the problem that we can't solve, and we do the best we can, we try to look at what we can do to provide the most access or get the patients the best care that we can.
One of the things that we have noticed is that lots of patients have a hard time accessing psychiatric services, and I think a lot of that has to do with the stigma. And so one of the unique approaches is taking that service to the primary health clinics. And that's an opportunity to meet people where they're at, and I think that is a lot more comfortable for many patients who might not be willing to come to a traditional outpatient setting.
I had been seeing a counselor, and I had a panic attack to where I thought I was going to have a heart attack. And I was trying to decide, do I see my counselor? Do I go to the primary care? I decided to go 5 minutes away to my primary care. I got there and they had just hired a care manager who came in immediately, taught me tools, how to calm down, and I was so impressed. I decided to have counseling with her.
The St. Luke's mission and vision absolutely is crucial because we're the trusted partner for the community's healthcare, and given that mental illness is such a big part of that, our place is huge. The mental health arm for St. Luke's is really growing a lot since I've been here in the last 4.5 years. In fact, I feel like lucky that I was able to be part of the initial, kind of get in at the ground floor, and we've done so much work and we have so much more work to do, but it's really exciting work, and it's great to be in a place where we can actually make a huge difference. How did that make you feel whenever that happened? We're one of only 4 states in the entire nation that did not have a partial hospitalization program for adolescents, but now in another couple months we're actually going to be opening that here through St. Luke's, so it's pretty exciting.
We provide care to patients that really treats them as a whole person and not just a person who happens to have cancer. I'm the medical director for supportive oncology, and we have a whole host of services that we really hope that our patients will take part in, including psychiatry, social work, for individual counseling, for family support, integrative medicine, giving patients relaxation techniques such as acupuncture, massage, that really provides benefit for some of the symptoms they have from chemotherapy. We also work with chaplains, nutritionists, patient financial advocates, and I think the best part for me as a psychiatrist working there is that part of the patient's care is as valued as the chemotherapy that they're receiving from their oncologist.
From the point of entry for our patients' care to when they leave our system or go back to maybe their primary care provider, we really are looking at integrating behavioral health in every step of the way. Not only by building integrated care teams in all of those settings, but also coming alongside the providers and the clinicians and the staff in those settings to do education, trauma-informed care. So it's not just the behavioral health clinicians that have the expertise, but all of our staff better understand the importance of mental wellness, mental health as part of a patient's health care.
I'm really excited about the care and services that we're going to be able to deliver for our patients that we're currently caring for today. I think we do an excellent job with the patient care and services that we provide here at St. Luke's today, and I can envision 3-5 years down the road of us being able to do this more seamlessly in a more coordinated and integrated fashion across the continuum of the healthcare spectrum.